Good day everyone, my name is Ronnel a registered nurse currently working as a fleet nurse in one of the cruise line company. I will be your nursing training officer for today. As a newly hired nurses in this company, it is essential to refresh ourselves with our nursing practice. One of the important topics to be discussed is blood transfusion. I will be guiding you for safe yet a quality care that we can provide to our patients. Our objectives is by the end of this presentation, you will be able to first, review different blood groups. Second, review the indication of blood transfusion. Third is to determine and demonstrate nursing procedure about blood transfusion. Fourth is review blood transfusion reactions. And lastly, demonstrate in managing blood transfusion reaction. Without further ado, let's start with the topic. Let's talk about blood. Blood is an essential life force constantly flowing and keeping your body working. Blood is mostly fluid but contains cells and proteins that literally make it thicker than water. Blood has 4 parts: red blood cells, white blood cells, platelets, and plasma. Each part has specific and important tasks, from carrying oxygen to carrying out waste products. Other blood groups will be discussed in the later part of the presentation, while the white blood cells or leukocytes account for less than 1% of your body and are part of your immune system. When invaders such as virus or cancerous cells launch attacks with your white blood cells, move quickly to find and destroy them. White blood cells can move from capillaries into your tissues. Now let's define blood transfusion. Blood transfusion is a transfusion can help if you have lost a lot of blood or if you have a certain health condition that affect your blood or bone marrow. You may need a blood transfusion if you do not have enough healthy red blood cells. Sometimes other treatments will be tried before you have a blood transfusion. The doctor will tell you about any alternatives. Let's now go on with the blood groups and its indications. First is the whole blood. This is the most common form of donated blood. From its original state with none of its components separated or removed, whole blood can help patients by being transfused directly into a single patient. The infusion time is mostly 2 hours to 4 hours in duration. Indication for whole blood transfusion is to treat patient who needs a large amount of component of blood, such as sustained significant blood loss due to a trauma or heart surgery. The second one is the packed RBC, or the packed red blood cells. Red blood cells or erythrocytes account for 45% of your blood. They carry oxygen throughout your body. They also help to clear waste from your body. The infusion time is around 2 to 4 hours in duration, and the indication for treatment for packed RBC is to treat patient with anemia in pregnancy or chronic anemia resulting from kidney failure or gastrointestinal bleeding, and those with acute blood loss resulting from trauma and or sickle cell anemia. Next is plasma. Plasma is a yellowish fluid that accounts for 55% of your blood. Plasma is your blood's utility player, covering many bases as it works to keep your body functioning. Each part has specific and important tasks, from carrying oxygen to carrying out waste products. The infusion time typically 30 minutes to 2 hours, slow IV infusion 2 ml per minute. The indication for plasma infusion is commonly used for patient with trauma, burn, and shock. The severe indication is liver disease or multiple clotting factor deficiency. The next one is platelets. Platelets or thrombocytes are first on the scene anytime your blood vessels are damaged and bleeding. Platelets manage bleeding by forming blood clots that seals damaged blood cells, so you don't lose large amount of blood. The infusion time is usually 30 minutes to an hour. The indication for this is to treat patients with cancer such as leukemia. The next one is cryoprecipitate. It is used to prevent or control bleeding with patient who has clotting abnormalities. It is a source of fibrinogen responsible for blood clotting by converting to fibrin. The infusion time usually 15 to 30 minutes, otherwise indicated. The indication of cryoprecipitate transfusion is to treat patients with rare hereditary conditions such as hemophilia A, who lack of factor VIII, and a von Willebrand disease, who lack von Willebrand factor. Let's now proceed with ABO blood type system. ABO blood type first discovered by Austrian physician named Karl Landsteiner, working at the Pathological Anatomical Institute of the University of Vienna in 1990. At first, in blood transfusion was drastically inclined due to the differences of serum of blood for compatibility. Noted that the RBCs of some individuals were agglutinated by the serum from other individuals. He made a note of patterns of agglutination and showed that the blood could be divided into groups. Now let's define rhesus factor or RH factor. Rhesus or RH is a type of protein on the outside or surface of your red blood cells. You inherit the protein, which means you got the RH factor from your biological parents. If you have protein, you are RH positive. Understanding the nuances of blood types is foundational to ensuring a successful transfusion. Human blood is categorized into 4 primary types, which is A, B, AB, and O. Each type can be positive or negative based on the presence of or absence of the RH factor. Type O is a universal donor, can donate to all blood types, but can only receive type O blood, while type A can receive A and O blood, type B can receive B and O blood, and type AB, which is the universal recipient, can receive A, B, AB, and O blood. Let's now proceed with the blood transfusion procedure. Blood transfusions are critically in hospitals, clinics, and doctors' offices. Like any skill, mastering this procedure requires patience and practice. Remember, everyone must start somewhere to seek guidance when needed. Let's now proceed with the preparation phase. Step 1. Consent and history. Engage the patient in a discussion about the procedure. Verify their medical history and any known allergies. Obtain signed consent for the transfusion for 3 factors. First is patient anatomy, which recognizing the patient's right to make decisions about their health care. Second is ethical practice, upholding the principles of medical ethics. And third is the legal protection, ensuring that the healthcare provider and the institution are protected against legal ramifications. Step 2. Blood type and cross-match. Draw a blood sample which is valid up to 72 hours. Ensure proper labeling with the correct date and time. Send the sample to the blood bank for cross-matching. Step 3. IV access. Secure an IV gauge 18 or larger, but it depends on the patient's size. If the patient needs other medications like antibiotics, set up a secondary IV access. Use only normal saline with blood products. Why? To prevent formation of emboli. Step 4. gather supplies, which is white tubing with an inline filter, normal saline solution, and a blood warmer. Step 5. Obtain vital signs. Record heart rate, blood pressure, temperature, pulse oximetry, and respiratory rate. Document lung sounds and urine output. Alert the doctor if the temperature exceeds 100 degrees Fahrenheit. Step 6. Retrieve blood. Once the blood bank is ready, schedule the blood pickup. Only 1 unit of packed RBC can be hung at a time. Start the infusion within 20 to 30 minutes of blood release and finish within 4 hours. Now let's discuss about initiating the blood transfusion. Step 1. Verification. 2 RNs should cross-check the physician's order, the patient ID against blood bank documentation, patient details, and blood type compatibility and blood expiration date. Step 2. Patient education. Inform the patient about the potential transfusion reaction symptoms. It is necessary to give them a knowledge on how to report transfusion reaction symptoms. Step 3. Patient assessment. Document vital signs, lung sounds, urine status, and color. Then, start the transfusion. Set up the white tubing with saline and position the blood in an infusion pump. Initiate slowly, like 2 ml per minute or 120 cc per hour for the first 15 minutes. Stay with the patient. Adjust the rate after that based on that patient's condition and reactions. During the blood transfusion, 1. You should monitor for reaction. Watch out for allergic reactions, febrile response, graft versus host disease, and transfusion-related acute lung injury. In case of suspected reactions, halt or stop the infusion immediately. Steps in managing blood transfusion reaction will be discussed in the later part of the presentation. On the other hand, post-blood transfusion, you need to flush the white tubing using normal saline, dispose of the tubing in a biohazard bin, and document the post-transfusion vital signs and any reaction if there is any reaction happen. Now let's proceed with the blood transfusion reaction. Transfusion reaction are adverse events associated with the transfusion of whole blood or one of its components. They range in severity from minor to life-threatening and can occur during a transfusion is termed as acute transfusion reactions. Days to weeks later is termed as delayed transfusion reactions. Transfusion reactions may be difficult to diagnose as they can present with non-specific, often overlapping symptoms. The most common signs and symptoms include fever, chills, urticaria, and itching. Some symptoms may resolve with a little or no treatment. The pathophysiology varies based on the transfusion reaction. Let's now talk about acute transfusion reaction. First is mild allergic reaction, attributed by hypersensitivity to a foreign protein in the donor's product. Signs and symptoms include hives and itching sensations. The second one is anaphylactic reaction. It is similar to mild allergic reaction, however resulting in a more severe reaction. Sometimes this can occur in a patient with IgA deficiency who makes the alloantibodies against IgA and then receive blood products containing IgA. Symptoms include swelling, breathing difficulties, hives, and decreased blood pressure. The third one is a febrile non-hemolytic reaction. It is generally thought to be caused by cytokines released from blood donor leukocytes or white blood cells. Symptoms are fever of 100.4 Fahrenheit or 38 degrees Celsius and increased by at least 1 degree Celsius or 1.8 Fahrenheit within the infusion time. It is accompanied by chills, rigor, headache, nausea, and vomiting. The fourth one is septic caused by bacterial byproducts such as endotoxins, which may contaminate the blood. The symptoms are fever, chills, hypotension, tachycardia, and the severe signs and symptoms is shock, which is the septic shock. Next is the acute hemolytic transfusion reaction. This can result in an intravascular or extravascular hemolysis, depending on the specific etiology or cause. Immune-mediated reactions are often a result of recipient antibody present to blood donor antigens. Non-immune reactions are possible and occur when red blood cells are damaged before transfusion, example by heat or incorrect osmotic condition. Symptoms are fever, chills, pain at the site of infusion, back pain, dark urine, and hypotension. Next is transfusion-associated circulatory overload or TACO. It occurs when the blood of the transfused component causes hypervolemia, which is blood overload. The symptoms are shortness of breath or dyspnea, rapid breathing or tachypnea, swelling in extremities or lungs, and a sense of being unwell. Next is transfusion-related acute lung injury. Acute lung injury is due to antibodies in the donor product or human leukocytes antigen or human neutrophil antigen reacting with the antigen in the recipients. The recipient's immune system responds and cause the release of mediators that lead to pulmonary edema. Signs and symptoms include shortness of breath, rapid breathing, frothy sputum, fever, and low blood pressure, which is signs of non-cardiogenic pulmonary edema. Now let's proceed with delayed transfusion reaction. First is delayed hemolytic transfusion reaction. It is typically caused by an amnestic response to a foreign antigen that the patient was previously exposed to, generally by prior transfusion or pregnancy. Symptoms are a drop of hemoglobin, fever, jaundice, hemoglobinuria or within 7 to 14 days after transfusion. Next is transfusion-associated graft versus host disease. Results from engraftment of donor lymphocytes, commonly found in cellular blood products, into an immunocompromised recipient's bone marrow. The donor lymphocytes recognize the patient as foreign and react against the recipient's body. The patient's immune system is unable to clear the foreign lymphocytes. This is rare but often fatal. Acute signs and symptoms are typically manifest as a skin rash, diarrhea, abdominal pain, and jaundice, while the chronic signs and symptoms is a more diverse symptoms including dry eyes, dry mouth, skin changes, and joint problems. So in case of any blood transfusion reaction, the nurse should do this following procedure. 1. Stop the transfusion. 2nd, run the normal saline. 3rd, is assess the patient including vital signs. Apply supplemental oxygen if distressed or low oxygen saturation level. 5th is notify physician for further assessment or to activate rapid response team. Administer medication in alternative line as ordered by the physician if there's any. Disconnect the blood including the intravenous tubing. Place the blood set on a red bag. Include the name of the patient, start date and time of the infusion, and stop date and time of the infusion. Then send back to the laboratory immediately. Continuously monitor the patient including strict vital signs, intake and output. Perform other diagnostic if required by the doctor, such as X-ray. Transfer the patient to the intermediate care unit if necessary. Then document all pertinent data, including accurate timing. We are finished with our discussion. I hope you learned from my presentation and become confident in performing this nursing intervention. Don't hesitate to ask with your senior if you are in doubt. Again, thank you very much and good luck to your professional journey.